One of the other questions I wanted to ask both of you is what you think will be the future in the treatment of male sexuality. You know, everything isn't always intercourse, and sexuality is much larger than that. So what do you think, aside from just prostate cancer survivorship, what do you think will be the future in the treatment of sexuality? And I'll have Courtney go first, since we haven't heard a whole lot out of you in the last few minutes, and we've let you rest while Jason was being tortured by me. So what are your thoughts, Courtney, on the future of male sexuality?
I think so. Obviously, we spoke about this before, just in general, it's just such a taboo subject. And I feel that now, like you said, now people are getting more comfortable talking about it and doing more research on it. And hopefully, my thoughts, obviously there's medications, there's, procedures, there's a lot of things that can, we can do and research and, find the best, newest stuff out there. But for me, even like with the therapy, the sex therapy, speaking about it, recognizing it, and actually like moving forward with it, that's going to be the biggest, the biggest thing for us, and actually like being proactive about it too. So whether it's, like I said, procedures or whatnot, or, it's just being able to recognize it and to, talk to your spouse or your significant other about, what you guys can do together, or talk to your urologist, or come see me at Moxie about it. There's so many people that can just discuss it and guide you, and you're not alone during this process. Like, we're here for you, we can help guide you, we'll be with you every step of the way. So just knowing that, more of the educational background, the process of what it is, how it is, and what it can be, that's going to be more on the physiological side of things too. So
thank you very much. And Jason?
Yeah, so I think, first of all, from a prostate cancer standpoint, I think one of the big things that's going to be have an effect in the future is just changing prostate cancer therapies and changing some evolving thoughts about how we think about prostate cancer in general. I think we're already in a realm where certain prostate cancers, lower risk prostate cancers, we're treating fewer of those men, and we're taking more of an active surveillance approach so that we're not subjecting them to such treatments that might cause erectile issues. And then there's other prostate cancer therapies that are coming down the pike as well that may be more localized, more targeted, more effective with fewer side effects. But I think as far as male sexuality goes, I think we're already seeing a bit of a revolution in terms of the space of social media. And this broadcast, this live stream is testament to that. But in addition to that, sharing stories and building communities online through social media, feeling more comfortable discussing it, and bringing it out into the open a little bit more. I think that's going to be sort of the future of where we go. We've also seen companies on the internet pop up, like For Hims, for example, who are providing medications for erectile dysfunction and things like that. And I think it's going to be important for us as healthcare providers to recognize that that's happening, and to work alongside our patients who are seeking treatment both outside of our clinics, but within them at the same time, which is the sort of the necessary reality to help our patients achieve the goals that they want to in a safe and effective manner. And so, it's hard to say what things will look like 20 or 30 years from now, but I'm excited to know that I'm going to be around here for it, and hopefully we'll be doing different things 20 and 30 years from now than we are today. It means we're making progress.
Well, the nice thing is that you will both be part of the next 25 years and what it will be, and you'll be part of the creation of that and what it should be and will be. I've watched a lot of changes in my 37 years of career, and one of the things that I've really enjoyed is seeing how we look at not diseases as standalone issues, but we look at them as part of the whole, and we look at things in a multidisciplinary way. And more times now, we're looking at the thought of prostate cancer survivorship as men's health and men's health survivorship. And that's becoming integral with men's health clinics. And the role of a men's health clinic should give us that psychological counseling pre and post-op, pre and post therapy, role, sexual therapy, overall physical health, mental health, Just today, there was an article that was published about the increased incidence of anxiety, depression in prostate cancer survivors. And we know that there's over 3 million prostate cancer survivors here in the United States. So all of these people who are watching tonight and or others that haven't taken advantage of the services that we provide need to know that they're not alone, and that mental health is one of the very important things about overall survivorship. And it's important that that services be available so that you can be the best self that you can be.